This video is about OET writing. Yes, let me take you right back to the heart of this task. A discharge letter in nursing is not an English exercise, it is a handover of responsibility. When a patient leaves the ward, your care does not end over there. It travels through your words, right? The examiner is not asking, can this person write English? No, the examiner is silently asking, can I trust this nurse with patient safety? That is why memorized formats fail. They look neat, but they don't think like nurses. So instead of a template, we use a clinical thinking lens. We call it as a care structure. So basically, it's not a structure, not headings. It's a way your mind should move while writing. So here, in this care, C stands for current condition, which means this tells the receiving nurse exactly where the patient stands at the moment of discharge. It answers what is the patient's health status right now and prevents guesswork. Okay, a clear current condition allows the next caregiver to continue the care smoothly without reopening the entire history. Correct? And A stands for assistance required. So, this one explains what the patient can and cannot manage on their own, because this is pretty important when you're explaining to another person, right? It transforms medical information into practical nursing action. What support is needed in daily life and care. Without this, the letter becomes informative but not useful. And R stands for risk and red flags. Yes, this prepares the next nurse for what could go wrong after discharge. It reflects a nurse safety mindset by highlighting warning signs and vulnerabilities. It shows that the writer is not only optimistic but clinically alert and protective. And E stands for expected follow up. So this points the care forward instead of ending it at discharge. So this point clarifies who will see the patient next, when, and for what purpose. It completes the care cycle and ensures continuity rather than closure. This is how real nurses hand over care, right? They don't narrate the past, they protect the future. Now let's place this care inside the real discharge letter. Let's see an example here. If you want, you can just pause the video, go through the case notes by yourself, understand and apply the care strategy, and come up with your own response. Okay, so this is the case notes for Mrs. Sharon Kimberly. Patient name is Mrs. Sharon Kimberly. Age 68 years, admission date 10/1/2026, discharge date is 15/1/2026, diagnosis is community acquired pneumonia, medical history type 2 diabetes, 15 years, hypertension, lives alone, reason for admission, shortness of breath, fever, productive cough, oxygen saturation low at admission, hospital treatment IV antibiotics for 4 days, oxygen therapy via nasal cannula, blood sugar monitoring, gradual improvement in breathing. Current status at discharge is afebrile, oxygen saturation 95% on room air, fatigued, occasional productive cough, still weak, limited mobility. Medications on discharge, oral antibiotics for 5 more days, metformin 500 mg twice daily, amlodipine 5 mg once daily, and care needs or assistance required, help with daily activities due to weakness, blood glucose monitoring, support with medication adherence, risk or red flags, risk of relapse due to fatigue and living alone, poor appetite, signs of respiratory deterioration, increased breathlessness, fever, worsening cough, follow up or next steps, review by GP in 5 days, community nurse visit twice weekly. So these are the case notes. Now you have to write a discharge letter. Okay. Okay, this is my discharge letter. This is how I write the discharge letter. Dear community nurse, regarding Mrs. Sharon Kimberly, aged 68, Mrs. Kimberly is being discharged today following a 5-day admission for community acquired pneumonia. She has shown steady improvement with intravenous antibiotics and oxygen therapy. At present, she is afebrile, maintaining oxygen saturation of 95% on room air. However, she remains fatigued and has an occasional productive cough. Her medical history includes type 2 diabetes and hypertension, both of which require ongoing monitoring. Mrs. Kimberly will continue oral antibiotics for further 5 days, along with metformin 500 mg twice daily and amlodipine 5 mg once daily. Due to her current weakness and reduced stamina, she requires assistance with daily activities. Please monitor her blood glucose levels and ensure medication compliance. As she lives alone and has a poor appetite, there is a risk of delayed recovery or relapse. Kindly observe for any signs of respiratory deterioration, including increased breathlessness, fever, or worsening cough. A review by her GP is scheduled in 5 days. Your visits twice weekly will be essential in supporting her recovery and ensuring continuity of care. You are sincerely charged nurse. You can write your name. Okay, now let's open it through care. So if you see here, the C, current condition, I've given very clearly. Mrs. Kimberly is being discharged today following a 5 day admission, so and so, and has occasional productive cough to that, right? So this is not storytelling. This is clinical orientation. The receiving nurse must instantly know why was she admitted? What is her condition now? Notice how the past is mentioned only to explain the present. The focus is now. That is C. Okay? And A for assistant required. So if you see here, due to her current weakness and reduced stamina, that all these things have been mentioned here, right? She requires assistance with daily activities. So please monitor her blood glucose level and ensure medication compliance. So this is where many candidates fail. They describe the patient but forget to describe the care. Here the letter clearly tells the next nurse she is weak, she needs help, she needs monitoring, right? So this transforms the letter from information into action. That is A. And then risk and red flag. So we have mentioned clearly, like as she lives alone and has poor appetite, there is a risk of delayed recovery or relapse. Kindly observe for any signs of respiratory deterioration, including increased breathlessness, fever, or worsening cough. Everything has been clearly given here, right? So this is the soul of nursing writing. We are not optimistic, we are prepared. The letter does not say she is fine. It says, here is what could go wrong. This tells the examiner this nurse thinks safety, right? So that is R. And E, expected follow up. Yes, we have clearly mentioned a review by her GP scheduled in 5 days, and your visits twice weekly will be essential in supporting her recovery. Right. So here the letter does not end with discharge. It points forward. It answers what happens next, who is responsible, how often. So this provides direction and completes the care circle. That is E. So when you write an OET discharge letter, do not ask what is the format. You have to ask what is her condition now? What help does she need? What must we watch for? What happens next? That is care. And when your letter reads like it was written by a nurse who is still caring after discharge, the examiners feel safe. Okay? So that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.